So I'm a member of the head and neck unit. I'm a surgeon, and foremost my role is to look after patients with head and neck cancer. So I see patients in the clinic. They get referred to me for various ailments, head and neck ailments. I assess them, and then we bring them to Lifehouse, and we discuss them at our head and neck meeting. And depending if they need surgery, then they come and have treatment under my care here at Lifehouse, or if they require radiation treatment, we may refer them to one of our radiation colleagues at Lifehouse. So that's my clinical role. I also participate in a lot of research, so we do a lot of clinical research into head and neck cancer. And then also we train our future workforce, so we train registrars who come through our training schemes, and also international fellows, so surgeons who've finished their training around the world who choose to gain greater experience in various head and neck treatments come and spend some time with us.
Is primarily to offer the surgical service and discuss the surgical options, but it's also to act as a counsellor, someone to guide them through their treatment process, to explain what they can expect, and to coordinate all of their care. It's a very distressing, very traumatic time for patients to receive this type of diagnosis, and being the first medical practitioner generally that you encounter, the first specialist medical practitioner you encounter with regard to the diagnosis, means that I'm usually the one bombarded with the hundreds of questions about what this means for them and where it might take them. The benefit of working in that type of situation is you have input from all your other colleagues, your oncology, your radiology, your pathology colleagues, and no surgeon really should be an island.
And why we're here and what we do is for the patient's benefit. So when we treat patients with cancers of all types, whether they're minor to major, less challenging, more challenging, if we fix the patient up, if we cure them of their disease, that is the biggest excitement for me.
The most rewarding part of my job? Well, there's two aspects to it. The first is when I've done a really good operation. I feel really good when I've done that, because you can see it, it's tangible, the patient can see it and appreciate it, and I really do enjoy that. But the second thing is, as I said before, that long-term relationship that you develop with the patient, getting to know them, and it makes the consultation days quite enjoyable once you've got to know somebody really well. And when it comes time to say goodbye to them, you can get a little bit sad.